Hi, Teach. My name is Edith Tatiana Rodriguez Sanchez, and I'm going to start with the development questions. Before I start, I think that it's very important to mention the type special fetal cardiovascular structures. These are ductus venous, ductus arterius, and foramen ovale. Going to start with the question number one and a question. I think that it's correct. Why? In the fetal circulation, there is very important one intermediate. It is one that interacts with the direct communication between the mom and the embryo. What is this structure? This structure is the placenta. The placenta, which in turn is connected by one other structure. This is the cord umbilical cord. This is formed by two umbilical arteries and one umbilical vein. It's correct. The question B, it's incorrect. Track the venous duct. The structure about we are talking is the duct venous. This is a small venous vessel in which connects the umbilical vein with the inferior vein cava. This pass only the 30 or 40% of the blood to reach the vena cava without passing the throat the liver. C. With respect to the question C, it's incorrect. The foramen ovale is not checked isn't its function. It isn't of dividing ventricles. It is dedicated. Its function is passing blood from the right atrium to the left atrium, and the right to the left, and through this. Respect to the question D is incorrect. The umbilical arteries are those that carry not oxygenated blood from the fetus to the placenta, not the contrary, to the placenta to the fetus. Question E. It's incorrect. The foramen ovale is an opening that allows the passage of oxygenated blood that comes from the interior vein cava to the atrium. Isn't not trace, isn't not its function, isn't its function obeys the one that allows blood circulation to the large or not. Although it can be said that for this stage the lungs are not fully functional, and so they don't perform gas exchange. Question number two, we're going to talk about question A. To begin, we must know that the dissociation curve shows the affinity for oxygen. In this curve, we can see the oxygen levels and hemoglobin saturation. The oxygen levels can be observed as partial observed. And about what I am talking? I am talking about feral hemoglobin. This is very different and important that we can to know the difference in the hemoglobin fetal and hemoglobin adult. So the feral, it isn't functional. It isn't functional hair system. The fetus has more affinity for the oxygen, since it is functional while the system adult, and it is subjected and to high ambient that this pressures for oxygen, while the fetus sustains low oxygen pressures. Question B, it is correct. I am talking about one structure very important. It is ductus arterius, who supports the communication of the pulmonary artery and the aorta. Since the volume from the pulmonary artery is greater, than that needed by the lungs. For this reason, it divides towards to the aorta, leaving a greater amount to the aorta and less amount to the lungs. To the question C and D, I think that it's incorrect. Regarding permeability with vasodilator effects, but this is prostaglandin E2, not G2. The question E, I think that is incorrect. 2.3 dpg, it isn't an anti-fetal circulation. However, um, if is with the adult causing a change to the right hemoglobin, if it causes the curvature to the right. To the right means that these levels are low, which is very true. Adult hemoglobin is lower and comparison to the fetal. To the fetal is it isn't slow. The fetal hemoglobin only has affinity for the oxygen. Going to start with the third question. Going to start with the A question. For me, is correct. This occurs by two mechanisms. The first is physiological, and the second is hormonal. The first, what happened, in which rapid waves of pulmonary vascular resistance occur. It's generated by lung expansion after their first breath, where the fluid is exchanged to had to begin to generate gas exchange. In terms of to the hormonal change to prostaglandins, nitric oxide, and oxygenation that interacts to generate oxygenation. In this way, the resistance to the blood flow that passes through to lungs decreased to a decrease in pulmonary arterial pressure and the pressure to the right and atrium to vertical. To question B, it's wrong. What really happens with the clumping of cord it is that the circulation and the nutrients that reach to the embryo are no longer there. Thereby, the systematic increase in vascular resistance occurs when the placenta is eliminated, which is really doubled that this organ sustained low resistance. With the question C, for me, is incorrect. A vasoconstriction doesn't occur. Since here there wasn't to contact of atmospheric or gas pressure at this stage of birth and increase in resistance occur. That is a pulmonary vasodilator. For question D, it's correct. One of the chains that its general habit is the closure or shoot, the shunts. When the umbilical cord it's tight and the newborn is separate, what it does is start to increase the pulmonary flow to the likewise increases the pressure to the left auricula as well as decreases the flow in the inferior cava decreases to the right arterial pressure. And the last question is E. For me, is correct. When the formation occurs, that is the close of the shunts. True. It is a terminal chemical and hormonal factors that act to that make that closer. Increase the oxygenation when this is neighbor breaks and by removing to the placenta. To act to the prostaglandin E2 and that decrease the constriction and closure is generate of pipeline in 21 hours. Okay, we're going to start with the fourth question. This question talks about the pathology. And to begin with cyanotic congenital heart lesions or cyanotic heart disease. That refers to group of many different heart defects to present at birth is to say congenital. And this causes low oxygen levels in the blood. They even have blue skin too. And let's start to questioning. That pathology is ventricle septal defect. This pathology it is a heart disease which occur when there is an abnormal opening in the wall to separate the right and left ventricles. Has nothing to do to low oxygen levels in the blood. Is to say it's incorrect. It isn't a heart lesion, it's cyanotic. With question B, atrial septal defect, it is a congenital where the wall between a right and left artery does not close properly, leaving a space between to the two arteries. It isn't a hair lesion, cyanotic. Doesn't have doesn't talk the pathology, nothing to do with the congenital heart lesion cyanotic. With the question C, it's a pathology called patent ductus arteriosus. That pathology is a congenital heart, yes, but her defect that occurs when the normal channel between the pulmonary artery and the aorta interferus doesn't close. Doesn't have to do about the heart lesion cyanotic. It is incorrect. That pathology aren't cyanotic. With the question D, theatrology of followed, that pathology are cyanotic. Why? That pathology causes for oxygen poor in blood to flow from the heart to receive the body. Risk factors include viral disease or during pregnancy or include alcoholism in pregnancy or a family history of a disorder. Yes, that pathology are cyanotic. Question E. Transposition are to degrade articles. Um, that pathology are cyanotic. Why? Causes to the abnormal development to the fetal heart during her first 8 weeks of the pregnancy. Yes. Normally, two causes from oxygen poor and blood returns to the right atrium from the body, goes to the right ventricle. And this is pumped through to the pulmonary artery to the lungs where it receives oxygen. Oxygen rich blood returns to the left atrium from the lungs, passes through to the left ventricle and it's then pumped throughout to the aorta into the blood into the body.